So you're using technology to do what, as you say, what may take other dentists, when it comes to dental implants, what may take 9 months, you could do in a few visits. Tell me about that.
Oh yes, in our office we invested a lot of money into new technology. So if it is an implant situation, we start the process with three-dimensional cone beam technology. So that tells us by microns how much bone patient actually has. We have an intraoral scanner. So Randy, you know, the traditional way of taking an impression is putting a gunk on the teeth that sits for whatever 5 minutes, you gag, and then it gets removed, and it's very uncomfortable. So with our technology, three-dimensional intraoral scanner, my assistant just scans the teeth,
like
just
a little
goes
wand
around,
in the mouth?
Little wand. She just scans around the teeth, and they're right there on the screen. And what we actually invested into recently is a 3D printer. So after my assistant goes around with a wand, she clicks here, she clicks there, goes to a 3D printer, and within an hour or two, there's a full set of teeth. So what do we do with those teeth? Let me tell you about our guided approach to implant surgery. So with all that three-dimensional information that we collected from the patient, we put it into the computer and we start planning the implant surgery. Basically what we do the actual surgery on the computer. Okay. Everything is prepared, so when the patient comes in, the whole process becomes so straightforward, much more precise, and much more comfortable for our patients. And for patients that go to a dentist that doesn't have that kind of equipment, what happens is they get numb, the dentist opens up the gum, they start searching for where's the bone, so they could guide that, so they could place that implant where the bone is. And when you open up the gum, that's where you get all the soreness, all the discomfort, all the pain associated with the implant, with the implant surgery. With us, sometimes we don't even cut the gum. We call it flapless. So we make that special guide, again, on the computer. We pre-plan everything. We make a guide, so we put that guide in, we make 1 or 2 drills, go in, place the implant in, you're done. No gum cutting, no pain. Sometimes we don't even give patient a motion because...
Could be a little bit of pain. Is that right?
Sometimes.
For some people.
Sometimes.
Okay. Now your center is a little bit different. I guess people need to know, you say, that how dental implants are normally done across the country is you go to one place that does the surgery. You go to another place for the imaging and another place where the doctor puts the teeth on top. You do it all right there. So aside from convenience, what's the big advantage?
Advantage is that I can control the whole process myself. Again, most of the dentists that place implants, they just look for the bone and they place the implant there. With us, the first thing that we do, we're looking at the restorative part. We look where the tooth ideally is supposed to be, and then we plan that surgery according to where the tooth is supposed to be. You're a cosmetic dentist, yes.
Right? I mean, you're known for that.
Yes, and as I told you, everything that we do in our practice is geared towards the cosmetics. So again, when we plan the implant surgery, we plan where we're going to put the tooth first before, and only then, according to where the tooth is supposed to be cosmetically to fit the mouth, only then we place the implant according to where the tooth is supposed to be.
Does it cost more to go to a guy that does both parts?
No, not at all. In fact, it probably will, long term, will cost you less, because with all the technology, state-of-the-art technology that we have, we sometimes keep a step or two, appointment or two in preparation. Okay. Plus, if you go to someone else, you have to pay him. Then when you go from there, from the surgeon, you go somewhere else to restore that tooth, you pay there. Being able to do everything in one office ultimately saves you money.
Now, you've trained all over the country for implant dentistry. Is that right?
Yes, just came back from LA a couple weeks ago, where I continue to learn new techniques in implant dentistry.
Is there that much to it?
Oh, there's a lot to it. It's not about just putting the implant in the bone. Again, we'll look at the end result first, and then we backtrack to place the implant.
So for people watching this, if everything goes right, so let's say they're a denture wearer or you can't save their teeth, how soon can they get their brand new set of teeth? In a month?
Yes, it can be 3 weeks, it can be a month.